Oh, sorry, Juliana. Look at you. Did email.
Hey, good evening, everyone. Welcome to the Virginia City Council chambers. We're going to call this meeting to order at 5 p.m. It's a special meeting regarding a notice of public hearing regarding the proposed property tax abatements. We have in the audience today representatives that are involved in us moving forward with this. This being live streamed, so all discussions are public information, public dissemination for all those who are listening to this tax abatement hearing. We have in the audience today, we have Mr. Eric Lohmeyer from Amoresco. We have George Eilertson from Northland Securities. We have Tammy Abdal from Northland Securities. And we have Dr. Mark Brusek. Thank you. And we have Keith Harvey in the audience, all a part of this process moving forward. So the purpose of this meeting is that we will hold the public meeting today at 5 p.m. on Tuesday, October 8th, in the City Council chambers on a proposed city abatement of property taxes levied by the city on property that has been identified as tax parcel code number 090-0180-00308. And the total amount of the taxes proposed to be abated on the city on the property identified will be as a pay-as-you-go abatement. The City Council will consider the property tax abatement to assist with the private development of a 12,000 square foot pediatric dental clinic with an estimated project cost of $2,750,000 in construction. All interested persons has been invited may appear at the October 8th, 2019 public hearing. Oral and written testimony will be considered at this time. Interested parties are encouraged to attend. Written comments could be submitted no later than 1 p.m. on Tuesday, October 8th, which is today, to the following: the City Clerk of the City of Virginia, 327 First Street South in Virginia, Minnesota, 55792. So we'll open this hearing up. First, I'll ask Pam, are there any written information or anything disseminated by the public, or anything in written form regarding this hearing? No written correspondence at any time regarding this hearing has been received by the city clerk on the day and time prescribed under the notice of hearing. So as we move forward with this hearing, the purpose is we can identify the parcel code, can we not? The area that we're talking about in this parcel code is the 4th Street project, which is there's some property that's open that used to be called Ewan's Field for those who are listening at home. And this is the property that's currently being proposed for development between Virginia Dental, or Range Dental by Dr. Berg, and on the other side, the Range Co-op. And that's a whole empty space there is being considered through a project development agreement and for the development of this property. And the portion of this partnership between the City of Virginia and SBB Development and all those parties involved are moving forward. So this is the tax abatement part of it, and it's the bond issuing part of it as well. So what I would like to do for the edification and clarification and additional information for the City of Virginia, I think I'd like to invite Mr. George Eilertson up, if he would, please. Pardon? I'm sorry, Tammy. Tammy, would you please come forward? The green light is on, so the microphone is on. Welcome to the Virginia City Council meeting, and thank you.
Good evening, Mayor, Council. I am Tammy Umdahl with Northland Securities,
and I'm here to present some of the financial background. And then, as noted, we actually have I'll call it in this case, the developer in the room to speak to the specific project. The council will have before you, after the closing of the public hearing, consideration of a resolution establishing this tax abatement for the city portion of the taxes. As background for the council and those watching this meeting, that term tax abatement is a bit of a misnomer. Under Minnesota law, it is a tool, a financial tool, that allows each of the 3 taxing jurisdictions, in this case, the city, the county, and the school district, to consider the increase, in this case, the city taxes from the proposed development in order to provide financial assistance to the project. The total estimated over a maximum term of 15 years, which is provided for in the proposed resolution of the city taxes to be subject to this tax abatement, is approximately $656,000. And that is the estimated total city taxes to be collected over that 15-year term. The actual amount of assistance would not exceed that amount. It may be less if over that term the actual city taxes are less, either because of valuation considerations or it is an extended period of time. The future city tax rate is unknown for that period. So again, should you approve this resolution, you are approving providing up to a maximum of $656,000 of, in effect, financial assistance to the project in order to make the project financially feasible. I'm happy to answer more questions and get into more detail should the council want to. Mayor?
Yes, thank you. Councilor Bearable.
Just a couple questions for you. I noticed this is a phase project. Part of the building is going to be in 2020, the other part is 21. What happens if the second phase doesn't go through? How do we mitigate or back off on that tax abatement? What is our process on that? Because this is a total of both the 12 and the 6,000, correct, for the abatement?
Mayor, Council.
Yes, thank you.
You are correct that it includes the 2 phases. There's actually an incentive for that second phase to be built, because if that second phase is not built, there is not going to be the taxable market value, so it will not generate those city taxes in order for the city to actually make a payment to the developer.
That's what I thought, but I wanted to make sure and clarify that.
And it
Okay.
was included for this reason. It gives the opportunity, because you approve the abatement now, that if that phase 2 is built and in need of that assistance, that the resolution as adopted in this hearing would provide for that. The alternative, if the council did not feel comfortable including that phase 2, you could exclude it at this time, but you would have to go through the same process of the public hearing, the notice, and amend. The term of the district would not exceed the 15 years, so whenever phase 2 would begin, it will be limited to whatever number of years is left within that 15 years, if that makes sense.
Thank you.
Welcome.
I have one question. So when the city, as we move forward here, and the city agrees to the tax abatement for the amount of $656,718, in the event that over this period of time, and we don't know what the tax implications are going to be for businesses, pending economic development, economic downturns, those kind of things, if the city was to actually collect more taxes from the facility, the abated taxes would be limited to only the $656,000. So say, the example would be if we collected $725,000, the abatement still would stay at $656, and the rest would return to stay with the city. Is that correct?
That is correct.
Thank you very much. Anyone else on the council have anything they'd like to add? I see we've been joined by Mr. Chris Bialke, also from part of SBB Development. I will add him to the list of attending the public hearing today. Does anybody else have anything they'd like to add?
Would just suggest that maybe we have them come up and talk about their project, what they're going to do.
Thank you. Rick, I didn't know if Mr. Eilertson was going to come up, but he's out talking with the Amoresco people. So would anybody like to come up and talk about the project? Dr. Bruzek, Mr. Bialke, or Mr. Harvey? We're excited about the project, so
We're getting excited. A lot of money to shell out, but just so people at home or you guys can get kind of caught up, we were very excited to get a big grant from the for a project to encompass a big medical facility. And due to our dismay, it didn't quite come through from the federal government to help with this project. And rather than let it die, we came up with an idea to say, why don't we invest in our community and allow us to keep this going forward. So we're able to work with Scenic Rivers and Ever Smiles to bring pediatric dentistry and underserved dentistry. And these gentlemen have some information they can share with you. And as my good friend, Dr. Brusek over there stated, the reason we didn't get the grant is because we're not in that bad of shape in Minnesota. And to me, that put a little, being disappointed, you realize that we don't have it so bad. So if we can continue to fund this project with the help of our community, we still think it's a wonderful project. We want it to go forward, but without the granting, we just have to go through some other means. So that's why we're coming here asking for the abatement to get the project going, because it is a big expenditure to spend out, and we have to get it priced right and rented right so we can bring them into our community to serve the underserved. So with that said, I'd like Keith to kind of come up and talk about the Scenic Rivers and what they will do for our community.
thank you, Mr. Bielke.
Thank you.
Mr. Harvey, good evening.
Thank you, Mayor, council members. Appreciate the opportunity to come and talk to you. I've talked to you before a little bit about this project. As Chris mentioned, we're disappointed that we were not selected to receive some of that grant funding that would have helped us really expand into both into medical, behavioral health, and dental. However, that does not preclude us from going forward with a dental clinic. One thing, through that process of submitting that grant, we were able to identify that Virginia is really a community that really needs more dental care, specifically for lower income, underinsured and uninsured individuals. What we bring is the ability to take care of patients on medical assistance. Right now, the majority of dentists in the community are not seeing medical assistance patients whatsoever. Understandable, they don't get paid for it. So why would they? From our perspective, we get paid for medical assistance patients something called cost-based reimbursement. Basically what that means is we get paid more to take care of medical assistance patients than private dentistry does. That allows us to really expand our service and provide dental services to those patients. When you look at our service area, and I do have some handouts which will kind of summarize Scenic Rivers, who we are, who we serve, and why this is an important project for us, and I'll hand those out when I'm done here. But we have the opportunity to take care of a lot of patients in Virginia, patients that aren't being taken care of right now. We recognize that primary care dental services for a community like Virginia are critical. We see it in all the communities that we serve. We have a clinic, dental clinics in Cook, Big Fork, Floodwood, and Tower. About 55% of our business is medical assistance. We're able to pay for that because we get a better reimbursement than if you were a private dentist. We see Virginia as a great opportunity because right now we get a lot of patients that come up to Cook and Tower from the Virginia area. Part of the problem that those patients have is there's a lot of barriers to getting to Cook, whether it's cost, traveling, our capacity. We don't have enough capacity to take care of them all. So to be able to open up a clinic in Virginia is going to be a great benefit to us. What's attracted us to this particular project is sort of working side by side with Ever Smiles. They take care of pediatric dentistry. We are not pediatric dentists. We take care of an adult population. But we take care of a similar population from a socioeconomic standpoint. So I think it really will be a great benefit to the community of Virginia to pull both of us together, to work together side by side in the community. And that 4th Street site is ideal. So, any questions?
Just to reiterate, before we go to Councilor Paulson, this is a approximate construction project that encompasses about $2,750,000. Is that correct?
Correct.
Thank you, Mr. Harvey. Councilor Paulson.
Mayor, thank you, Keith, for moving forward project. And I know that we were excited about all 3 portions of the original project, but I think it's really important because I do know a lot of people that are traveling to up north, especially to Cook, to get those services, and they're waiting quite a while. So I think Virginia is underserved in that respect. I have a couple questions. Would the building then be able at any point in time to be expanded upon to include a potential clinic or mental health services if and when financing or funding would ever become available?
You know, I think I may defer that to Chris and maybe Dr. Bruza, because they're going to be more of the primary developers. We're certainly interested in to continue to look at bringing both medical and behavioral health services to the community. It only makes sense to do it in one site. We're not going to want to be all over the place. So that's a very definite possibility.
And then the other question I had, and I don't know who would be the best party to answer this, but since the population is the Medicaid population, has the county been requested to be a part of this project in terms of funding at all with that?
Yes, both the school district and the county have been talked to, and when we will be meeting with them.
And they made it a point to become a partner financially?
I think we're still in that process. We're looking to talk with them. Yeah.
Okay, I appreciate that. Thank you.
And, you know, like I said, medical assistance right now is about 55% of our business. So we do take all patients, and we take patients with no insurance. We offer sliding fee scale. So if patients can't pay their bill, we offer them discounts based on their income. So we take all comers. We don't turn anyone away.
Thank you, Mr. Harvey. I think we'll have a couple more questions. I think that the partnership between Scenic Rivers, who provides the adult dental care, and Dr. Bruzak, who does the pediatric care, in conjunction with the development team of SBB, you know, working with the city, we're hoping this is going to be a successful project. As the Councilor Paulson alluded to, that this is a need that the community has, and a need we have an obligation to the city to try to work with partners who wish to provide it. We think this is a solid business plan, so we hope to continue this project moving forward. Councilor Johnson.
Mayor, I too want to express my gratitude. I am one of those people that I do foster care, and to find dental care for children on Minnesota General Assistance, medical assistance, or whatever title they give it, is almost impossible. It could mean a day trip to Deer River to get treatment. So the ability to service those children here in town, it impacts their lives greatly. That it's a difference between taking an entire half a day off to go to Cook or a whole day to Deer River, as opposed to an hour dental appointment in the middle of the day, is huge. So I can't thank you enough, and I think this is an amazing use of government to help facilitate what our needs are. It surprises me that we aren't in need as much as other people are, as Mr. Bielke mentioned, but being boots on the ground, I find that very hard to believe. I'm just guessing it's just a statistical analysis that did not sway in our favor, but I appreciate this, and I really hope that the county and the school board see it the same way so we can move forward with this.
Thank you. Keith, anything else?
No, not at this time.
Councilor Baraboo?
Keith, just for edification, that grant that you were looking for, can you specify the amount that it was originally that you were looking for from the feds?
Right, it was titled a New Access Point Grant, and it would have been $650,000 a year, an ongoing grant that would have been part of our operation.
Okay, so that would have taken care of operations then too.
Would have taken care of a lot of things.
Yeah.
It would have really taken the risk out of coming into the community. Just so you know, there was $75 million appropriated. There were 600 applications, and 75 applications were granted. The majority of the applications were granted in the southeastern part of the country, There were 12 in Puerto Rico. There were none in Minnesota, none in Wisconsin, none in North Dakota, South Dakota, Iowa, one in Michigan, one in Illinois. So just kind of give you some background on that.
Did you folks calculate the abatement if the county goes along, what amount of money, 400 and some thousand, or do you know what it is? Or maybe,
I didn't.
you know what that is?
Yeah, we
Reason I'm asking, I want to see how much you're getting out of abatement to totally fund this project, is my question.
I think it's listed on our handout, but please would you answer that?
You are correct. It is listed on that as prepared by Northland.
Oh, I'm sorry, I missed,
Yeah,
I didn't
the
look
estimate
at
for the
that.
county portion, so
300,
there, if they approve it, tax abatement is a maximum of about 301,000.
All right, you answered my question, thank you.
Thank you. And I think maybe if you would please, Dr. Bruzak, could you please come up and just give a brief synopsis of EverSmiles and how that works? Because that was a very heartwarming and touching story on how you move forward with this project. So thank you and welcome.
Thank you, and I appreciate your invitation to be here, Mayor and council members. Just a little bit about EverSmiles. EverSmiles is a pediatric dental clinic. Our clinic is in Hermantown, Minnesota, and we service certainly the greater Duluth area, but our service area is much wider than that. We get referrals and patients as far west as the North Dakota border and as far east as the Upper Peninsula and south down to usually Hinckley and maybe a little further south than that. The majority of our patients, of course, are children. We have very few adults in our practice, but those adults are learning disabled. Generally speaking, can't find any treatment elsewhere. Personally, I don't have any adult patients because I have a limited practice in children's dentistry only, meaning I'm able to service 18-year-olds and under, but 3 of the dentists in our clinic can also service learning disabled adults. All right, a little bit about our business model. We are not an FQHC. An FQHC can tap into some other types of funding that are usually federal and or state. We are a fee-for-service for-profit clinic. With that in mind, we tap into certainly the third-party payment system that you will commonly find in industry. We also have self-pay, but we have a considerable amount of government-funded children in our practice as well. I think Keith said they have about 55%. Last count, we were about 47%. I do have a position paper I'll pass around also, just like Keith has, and that'll give you a little bit of information on that as well. Regarding that 47%, that's where we are right now. That fluctuates in the early stages of my practice. Back in the early 80s, it was about 13%. And since then, over the years, we have seen a little bit of degradation in the middle class and a lot of people falling into the lower socioeconomic class. A lot of those are kids. And those kids we have seen over the years grow in our practice. And I think that continues to grow. And because of that, we felt that the range has been a primary site of our referral base, and that certainly Virginia was the center of the range in our opinion. This opportunity came up. Part of our business model is to not only service these children, but also to build clinics that are child-friendly. Not only for those that we serve that are underserved, but certainly we want to attract the self-pay and the third-party payment commercial insurance companies. That helps us subsidize the losses that we take in the government-funded programs. And they are considerable. I think the common figure referred to is about 40% of our practice is what we will call payment for services, and 60% goes to payment of those services. So what we do is we have about a 60% hit, and we are receiving about, maybe at right now in the neighborhood of about 38% of our fee for service through government funded. We did that, it was worse than that, believe it or not, until we were labeled a critical care clinic. And to become a critical care clinic outside the metropolitan area, you have to see at least 25% of your patients that are funded by either the government-funded Medicaid system or self-pay or charity work. And that's where our 47% came in. So the tax abatement would make a considerable dent in our losses and help us certainly build this building and house it for the next 15 years. I'll open up to any questions. Yeah.
Just have one question, Doctor. So, and I asked this earlier in a meeting prior, but for the general public's information, you've been in practice in Hermantown since when?
I joined my partner, Dr. Connery, in 2009 officially. In Hermantown, we opened up our clinic there, built an office in 2011. So we've been in Hermantown since 2011. Prior to that, we rented a very small space at the Lake Walk Surgery Center building.
Thank you, Doctor. Counselor Paulson.
Remember that space at Lake Walk?
Yeah.
I do. And I was just wondering if maybe you or Chris Bielke could expound on the potential expansion, if that would be okay, and if that would become an opportunity perhaps in the future, or how you would address that.
Certainly. We were also disappointed, just like Scenic Rivers and Keith alluded to, that Scenic Rivers did not get the grant. It meant a lot to us if we could have gotten it, and it would have been a much more significant project. So we are tailoring it down somewhat. We are meeting with our architects. Actually, it'll be this week. And our intent is to make the building amenable to additions, and particularly to a medical component. So as part of that development process, and I am part of that development process, as is Chris, we'll hopefully have the ability to add on a portion anytime that it comes available.
Thank you. Mr. Bielke?
And to that point, we are looking at partnering with Scenic Rivers and other entities to grow the mental health and some of those, if it comes to fruition. And to the point earlier about the abatement and the benefit of bringing more medical facilities to this site, the quicker we can do it, the bigger the abatement. That's a pretty good carrot. So the partnership with the city and us as developers, it's a scary proposition for me and Doctor to shell out some money and go for this, but it's good for the community. It's good for EverSmiles. It's good for Scenic Rivers. We want to make sure it goes through fruition, but we want to be able to expand and grow, and to do that, that abatement would help us. So just to cover those 2 points.
And just have one more question, just to clarify. The potential expansion for a medical component or whatever that term is going to be, the project currently as proposed, not including a potential expansion at some later time, is still slated at about $2,750,000. Is that correct?
We will know better after Friday.
Okay, we will know the specific number then.
Yeah, yes, we threw that number in from the initial
Right.
Development package we got from the architect. I've never built a dental facility. I've never even built a house on my own. So we're just kind of going along for the ride. I don't know if they have gold crowns in there or not, but I think we can safely assume it'll be under that cost. Yes, we want to put up a facility, but with the expansion that you guys are doing in Virginia and all over the range, we're finding the costs keep going up and up and up, and to get workers and stuff, it's gonna be real close to that number.
And I think all that will be vetted out as we move forward with a potential project development agreement with SBB and Eversmiles and Scenic Rivers too, so.
Correct, and we've been in contact with other medical professionals, potentials that would be looking at coming to that facility as well. And we're trying to work through Scenic Rivers specifically because I don't run a clinic either. So I'm very unknowledgeable, unlike these gentlemen, so.
Well, thank you, Mr. Bielke. Counselor Beard, would you have something else you'd want to add?
Not for Chris, but I do for this young lady.
Tammy?
Here.
Tammy, I noticed in the proposal here that you've got it's assume pay for 2019. Well, how are you supposed to do that? It should be for 2020, pay 21. Because you can't do a backward year without the construction being done.
You are correct. We are assuming that construction in 2020 and 2022 would be the first payment year. I'm looking to see if you're referring to a date in
Well,
the
it
resolution.
says on your chart here, assume pay 2019 tax year.
Oh, I can explain that. The tax rate is based upon pay 2019 for estimating the tax abatement, because that's the best information that we have available. And so each year, the tax abatement will depend on what the property is assessed at for tax purposes and the city's actual tax rate. To the extent that the value is higher than what is estimated presently, and if your tax rate is higher than what it was in
That gives
pay
us a-
2019, they will be paying more in city taxes, and you would be abating, but you're agreeing to abate not an amount not to exceed that annual city taxes up to $656,000 over that 15-year term.
So that's the bottom line, and it's a 650? Okay.
That is correct. So to clarify, the question is, why does this have 2019 tax information?
I understand now.
Yeah, it's
Okay.
just the tax rate that is estimated based upon that.
Probably better for us.
Good question, thank you.
Okay.
Thank you.
I'm not against this project, Mayor, I just had to ask that question because I hadn't seen that in one of these abatements before.
That's part of your investigative prowess, Counselor Bearable. Okay, is there anybody else that have any, Counselor Johnson?
Thank you, Mayor. Is this the resolution done here, or is this just, okay, so I will move the resolution approving the property tax abatement for the identified property not to exceed 15 years in an aggregate total and not to exceed $656,718.
Moved by Counselor Johnson. Is there support?
All support.
Support by Counselor Bearable. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries. Thank you. If there's nothing else that likes to come before the council today with respect to the public hearing on this tax abatement issue, is there anybody else that'd like to speak on this subject? Is there anybody else would like to speak on this subject? Are there any other comments regarding this tax abatement public hearing? Seeing none, we'll call this meeting closed. Thank you. Okay. Thank you very much, gentlemen. We'll roll right into the council meeting. It's scheduled for 5:30, so welcome everybody to the Virginia City Council meeting. Today's date is Tuesday, October 8th, 2019. I will call this meeting to order at 5:34 p.m. Pam, and welcome to everybody in the audience today. We have some presenters and those of you who are listening at home. Pam, would you please take the roll call?
Baraboo,
Present.
Friedlieb, absent. Paulson,
Here.
Yondich,
Present.
Johnson,
Here.
Aaron Sally,
Here.
Cuffey.
Here. Would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Well, item 3.1 on the agenda, it's a proclamation. We have many of those throughout the year. This one is related to proclamation to recognize Pharmacy Week. Whereas pharmacists are experts in the successful use of today's complex medications, and whereas patients in hospitals and outpatient clinics receive better care when pharmacists are directly involved in medication management decisions, and whereas pharmacists' direct involvement in patient care helps reduce unnecessary costs and burden on the healthcare system, and the pharmacists and pharmacy technicians practicing in the acute and ambulatory care settings of Virginia, Minnesota contribute to the health and well-being of our citizens. And whereas ASHP and Essentia Health have declared October 20th through the 26th as Pharmacy Week. Now therefore it be resolved, I, Mayor Larry Cuffey Jr., and the members of the City Council do hereby proclaim October 20 to the 26th, 2019 at Pharmacy Week in Virginia, Minnesota, and urge all our citizens to acknowledge the valuable services of the pharmacists and pharmacy technicians who work in inpatient, outpatient, home care, and long-term care settings, and all they do to help patients make the best use of their medicines. And with this hereof, I on to set my hand at cause this seal be affirmed, Mayor Larry Cuffey Jr., City of Virginia. Thank you. Any comments, former retired pharmacist Baraboo?
I would like to just make one comment. This is very, very appropriate. Our hospital is utilizing pharmacists in a very unique new way now. They are actually going around with the doctors as they treat patients and stuff and doing consultations on medications with the doctors. It's something new they've just started this past year, 2019. So it's a very beneficial part of what's going on, because your physicians nowadays do not get a long, broad repertoire with medications any longer due to all their specialty and other things that they do in their medical field. So this is being done here in Virginia, Minnesota, so it's really a good program. Thank you.
Thank you, Councilor Baraboo. We'll move to item 4 on the agenda, which is a public forum. In our agenda authorizes and welcomes any citizens that would like to speak before the council chambers in the audience today. So at this point in time, if anybody in the audience would like to speak, have any questions or comments about the city business or have anything at all they'd like to discuss, please come forward now at this time. Seeing none, we'll move to item 5, which is the consent agenda. The following items will be enacted by one motion unless a councilor or a citizen of the City of Virginia considers this item to be conferred separately. Item 5.1 is the approval and the correction of the regular minutes of the regular meeting that was held on Tuesday, September 24, 2019, the public hearing on September 24, 2019, and the special council meeting that was also held on September 27, 2019. Item 5.2 is the adoption of finance resolution number 19-019, the schedule of bills. Item 5.3 is approve the pay estimate number 3 to Casper Construction for the Midway Drive Improvement Project in the amount of $484,283.98. Item 5.4, approve the pay estimate number 3 to Basabi Bitubitis for the 12th Avenue West Improvement Project in the amount of $217,437.51. Item 5.5, approve the travel request for Britzy Bennis, Pamela Bean, Wendy Summers, and Jen Mogensen to attend the election training on October 31st, 2019 in Hibbing, Minnesota at a whopping total cost of $89. Item 5.6, approve the travel request for Jason Picard, the Police Department, to attend the DMT-G certification course November 12th through the 14th, 2019 in St. Paul at a cost of $665. Those are the consent agenda items that are on the agenda today. We ask the council for approval. Is there a motion?
Also move the consent agenda, Mayor.
Moved by Councilor Baraboo to move the consent agenda for approval, supported by Councilor Johnson. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye, opposed? Motion carries. Thank you. We'll move to item 6, appearances. We have in our audience the opportunity to hear from Mr. George Eilertson from Northland Securities, financing recommendation for the energy efficiency improvements regarding a project we're moving forward with. And welcome, Mr. Eilertson, to the City Council chambers once again.
Thank you, Mayor, members of the council, and thank you for the time on your agenda this evening. If you recall, on October 1st last week, I attended the Committee of the Whole meeting and reviewed a financing alternative for the energy efficiency improvements that the city is considering. As we reviewed, the city has an approximate financing need of $1.4 million for the project. At the meeting on October 1st, I presented an option which is the issuance of general obligation charter bonds, and reviewed that as one of the options that the city could consider. In addition to that, I reviewed briefly the implication on the statutory debt limit. In your packets this evening, I provided a memo along with an overview of the city's statutory debt limit. And actually, I'd like to review that, Mayor, if I could briefly first. I think that would lead well into the topic. In your packet, again, there's a review of the statutory debt limit. That is 3% of the city's estimated market value. The city has a Pay 2019 estimated market value of approximately $364 million. 3% of that results in a statutory debt limit of approximately $10.9 million. The city has 3 existing bond issues that count towards that limit. They total approximately $2.1 million, resulting in a net debt limit margin of $8.7 million. So that's the legal remaining value of your statutory debt limit. We've had some discussions about what types of projects or what kind of bond issues count towards that limit. Street projects, for example, because there are revenue sources other than just taxes are exempt from the statutory debt limit. The general obligation charter bonds, which I presented at the Committee of the Whole meeting, do count towards that statutory debt limit. So that's certainly one of the factors that we weighed into the recommendation that I'll have here shortly. So again, just to recap, the city has a remaining debt margin of $8.7 million. If we did the general obligation charter bonds, that would count towards that limit and reduce the remaining capacity to $7.3 million. Now, I had the opportunity to review the lease option that Ameresco had referenced as an option that they could assist with. I reviewed that with the Ameresco representatives as well as with the city's bond attorney from Freiberger Buchanan. And following that review, it's actually my recommendation that the city consider strongly pursuing the lease financing with Ameresco. And for the 2 main reasons that follow. One, the lease can be structured so that it's not subject to your statutory debt limit. As per the city's bond attorney, leases that exceed $1 million would become subject to the debt limit. And reference that, or recall rather, that I mentioned that the overall financing need is approximately $1.4 million. What the lease financing can be structured into 2 separate leases, each less than $1 million, and each could be closed approximately 3 weeks apart. Those were kind of the 2 provisions that the bond attorney said would keep them outside of the debt limit. So that's key, Mayor and Council, that in light of the city's consideration of a future public safety project, I think it's important to maintain or preserve as much of that debt limit as you can. So again, I think the lease financing being exempt from the debt limit is a key point. And the second key point that I referenced in a memo was the call feature. If we did a traditional bond issue with a 15-year financing, those bonds would be likely callable after about 7 years, 7 to 8 years, meaning that the city would have to follow the bond payment schedule and not have the ability to prepay or exit that financing until approximately year 7. As per the representatives from Amoresco, the lease financing can be callable on any date. So that's a really a nice flexible feature for the city. Gives you the opportunity to exit that financing if you have additional savings that are generated and you have the ability to buy down the principal. That would be an option that would exist. So those are two key factors. One, again, being exempt from the statutory debt limit, and second, being callable on any date. Certainly a third feature that we looked at was, is it comparable to the general obligation bonds? We want to make sure that we've got a financing result that is comparable. The general obligation bonds can likely be financed at a lower interest rate, but we looked at a longer financing structure than the lease. The lease had the ability to have a little more flexibility with the structure, allowing a shorter term, and yet achieving the city's objectives. So again, it's a combination of those three things, Mayor and City Council, that I'm recommending that that the city rather look at the lease structure for the equipment, for the energy efficiency improvements. This can certainly address any questions you may have.
All right, thank you, Mr. Arledson. We'll go around. Does anyone have any questions or comments? Councilor Paulson?
Thank you. I just want to compliment both of you for working together. I really do appreciate that. And with Shannon, what is the interest rate then in the lease for that $1 million cap? What compared to the general obligation bond interest rate?
If okay, Mayor.
Permission to approach?
Yes, John?
We'll just share the podium here. I'm sure there can be lots of questions.
Thank
So
you.
again, appreciate the opportunity to be here tonight, Mr. Mayor, council members. The interest rate, well, so in the original proposal that I had presented, which was a number of months ago now, we did a very conservative rate of 2.95%. And actually, the rates have dropped down substantially. So what we're going to do on your behalf, assuming you want to move forward on the lease, is put an RFP out on the street. And we have already presented our lease format to City Administrator Britt and up for review. So that would be the process. So we would put it out on the street, basically a 5 to 7 day response time. Since this is under $1 million project, the responses come back pretty quick. And then we'll summarize all those responses for City Council and let you folks decide.
So
Terms and conditions.
it'll be below 2.9%.
I would assume so.
You would assume
yes.
so. And then what was that in comparison to the general charter bonds rate?
Mr. Arledson?
Sure, thank you, Mayor, members of the council. We presented at the time, the bond market for a 15-year bond issue was approximately 2.9% as an average interest rate. I'm sorry, the lease was approximately 2.9. The general obligation bond, was closer to 2.2%. One of the factors, and I didn't mention this earlier, certainly is with the open market financing or the general obligation bond that I referenced, there is costs of issuance certainly that bring the overall borrowing amount higher as compared to the lease. That's one of the advantages of the lease. I'm not here just to do a commercial for the lease financing here, certainly. But we had a bond rating fee structured into ours. We have certainly the municipal advisory fee as well as the purchasing firm or the underwriting firm. So there's higher costs of issuance, which offsets that interest cost savings.
That clarification, both of you.
Sorry. Councilor Bearable?
Yeah, so I'm assuming, Britt, that you've had conversations and you're looking more toward the lease option with the lack of it being attached to our general obligation bonds, correct?
Yes, George called me on Thursday, I think, of last week, and did tell me that he he'd been talking about it with our bond counsel and feels that maybe the lease would be a better option for us.
Yeah, and I agree with that, because we're looking at a couple of big projects out there, the street work, and then if that public safety goes. So I agree 100% we should go that route. Because we'll be still talking with George here down the road here. We've got a meeting coming up here, in fact, on the street stuff, so I think on the 10th, right? Yeah, so, okay. Thank you, George, for working like you did.
Thank you, Councilor Bearable. Councilor Johnson?
Did the communication with public utilities, has that been all taken care of yet?
Not yet, no.
Or
It is the full intent of the Public Utilities to sign the agreement once we get it completely drafted between the two of us. It has not been drafted yet.
are you comfortable with us moving forward tonight, authorizing the RFP for the lease as opposed to the bonds? Is that something we?
You know, I would be comfortable because I have seen the lease, but I caution that none of you have seen the lease yet. Tom and I have both seen it.
Would be, we keep putting this off 2 weeks and 2 weeks and 2 weeks, and I'm starting, I can feel the frustration from our contractors and potential contractors, and, you know, I guess.
If we allow John to proceed, Mr. Neville from Amoresco, I do believe he'd have to come back with the proposals, and we'd have to approve them again with what he's received from the RFP. We would see them.
We can authorize the starting of the
RFP,
process.
yes.
Okay, I guess that's what I want to make sure, that we don't have to sit here for another 2 weeks, and pretty soon winter's here and we can't get a project started because of the weather. So I guess I'll make a motion to authorize moving forward with the RFPs, and knowing that we'll see those and the lease sooner than later.
Is there support?
I'll support, Mayor.
Moved by Councilor Johnson, supported by Councilor Bearable. Is there any further discussion? I have one before we go to Councilor Paulson. For me, it's about making sure that we, even though it's been a long and arduous process, I think that it behooves me as I'd like to see the lease. I'd like to read the lease. I'd like to see what it says. I have no problem moving forward with the RFP. We're not making a decision to move forward with the lease at this time. We're obviously gravitating that way, but the purpose is to put the RFPs up to get the ball rolling so we can get it done as quickly as we possibly can, because the next item on the agenda is 6.2, which we would probably have to refer that back to the committee of the whole meeting so that we can take care of that as well. Councilor Paulson.
Thank you, Mayor, and I think I was thinking on the same line as you, and I just wondered if our attorney maybe wanted to let us know a little bit about what's in that lease? Or from your perspective?
Not right now.
Okay.
Well, I mean, it's your basic lease. I mean, the issue really, I think George laid out was the interest rate, plus, I guess, the idea that if in fact we decide to go another financing route, we could get out of the lease and go with that route. But still, I think the council, you know, I mean, it's a significant number here. I think the council should look at it and have questions. I'm sure you will, right?
Sure, I will. Thank you.
Yeah.
Okay, thank you. Any other comments before we vote? Yes, yes, please,
If I may
John.
clarify, so just to clarify, so the document that you're approving is basically an RFP that Amoresco will issue on the city's behalf to go out for approximately $1.4, $1.3 million for the project. And then we'll send it out to various financial institutions. And actually, if you have any local institutions that you would recommend, please provide those, because we'll add them in. We will have, assuming approval, we will have that document ready for you to look at by this coming Monday, so you'll see what's going out under your behalf. And then typically, as I mentioned earlier, it's a 5 to 7 day turnaround time. So we'll have all these lease documents back with rates and terms. We'll summarize all those, bring them to, we'll send them. You folks can review them all, and the one that you select, that lease, which is a tax-exempt lease, pretty standard, will be available for the entire council and attorney, city attorney to review. That's kind of the process, just to clarify.
Sure, I think that's appropriate. Counselor Paulson?
So just to clarify for me, John, the lease is not between the city and Amoresco, then the lease is between the city and whomever the contractor is that is
Yes.
selected from the RFP.
So we have a whole financing network, Citibank, Wells Fargo, Bank of America, et cetera, and we always look for local institutions or banks that you already utilize or any financial partners that you're interested in. And then they just provide their responses back, and you folks are selecting, so it's not leases between you two parties. We're just the conduit,
Thank you for that.
yeah, on your behalf.
Okay, thank you. Anybody else? So it's been moved and supported. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carries. Thank you, gentlemen. Tammy, thank you. Now we're going to move to item 6.2 on the agenda.
Because we have chosen to not bond for this project, we can remove item 6.2.
Okay, so thank you. I was wondering if we need to move that for official consideration in the next Tuesday meeting, but we can forego item 6.2 for the time being. So we'll forego 6.2 pending the information coming forth on the lease. Thank you, gentlemen. Thank you, Tammy. Thank you, everybody. Okay. All right, we'll move to item 7, unfinished business, and ironically, we have no unfinished business. So we'll move to item 8, which are discussion items. Item 8.1 is adopt a resolution to make application and accept funds from the Virginia Community Foundation for the Downtown Redevelopment District Commercial Rehab Program, and I think they're dedicating, what, $50,000? Is that correct, Britt?
We put in an application for a grant for $50,000 for next year.
Okay, thank you. So we'll need a motion for that.
I'll move the resolution authorizing the city of Virginia to make application to accept funds from the Virginia Community Foundation.
Okay, moved by Counselor Paulson and supported by Counselor Johnson. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carries. Okay. Item 8.2, adopt a resolution enacting and adopting the S-1 supplement for the Code of Ordinances. As you recall, we have been codifying our code book and ordinances, and these were submitted for approval and inclusion in our code books, and we need a motion to adopt the resolution and adopting these supplements for the code of the city of Virginia. Counselor Barnzelli?
I'll approve that motion, Mary.
Counselor Barnzelli makes the motion to approve and adopt. Is there support? Is there support? Support by Counselor Johnson. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries. Thank you. Item 8.3 is adopt a resolution accepting a donation for the fire department. What is that donation, if I may ask?
It was a donation of $100.
Fantastic. $100 to the fire department, and we need to adopt a resolution or to approve the acceptance of that donation. Is there, moved by Counselor Johnson to approve, is there support?
I'll support, Mayor.
Support by Counselor Bearable. Is there any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries. And item 8.4, accept a resignation with regret, obviously, from Ellen Taub from the Human Rights Commission.
Make that motion.
Motion by Counselor Johnson. Is there support?
I'll support, Mayor.
Support by Counselor Bearable. Is there any further discussion? We should, okay, Counselor Johnson.
Thank you, Mayor. Ms. Taube is one of the things that I think we're trying to work on is figuring out how to keep the Human Rights Commission active. And the college has a human rights a diversity committee that meets regularly. So we've been trying to talk to them and seeing if there's a way we can incorporate the two meetings together. I've been talking with Britt about it a little bit, and it's something that it would just mean a changing of the place. There's already minutes kept. Everything would work, except we would actually have a committee of active people. So that's something that's in the works that we are working on, just so that our Human Rights Commission doesn't fade away again as it had for many years. So, but I do accept this with regrets. Ms. Taube was amazing at organizing and keeping this going for the last about 3 years. So appreciate that very much.
And could we send a letter with our sincere thank you for all our hard work as serving on this Human Rights Commission, because it is a challenge sometimes. Thank you. It's been moved and supported. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye, opposed, motion carries. And if I may, I'd like to add one more item on the agenda, 8.5, and would have sent this out to you, but I just got the call late this afternoon. There's a request from the Virginia Foundation. They're going to make their move to their new building from their old downtown building on the 500 block to a new building in the 300 block. And they're requesting some assistance in parking for tomorrow between 1 and 3. They'd like to have us block off a couple of spaces. They could park a truck and a 16-foot trailer to help effect the move of some of the equipment and the furniture and things from the old foundation building to the new foundation building. They planned on doing it over the weekend, but the weather's not looking very well, so they're making that request now. So I bring it for the council for approval, and to have our Public Works Department set up some spaces available to allow them to do that. And they'd like to do that between 1 o'clock and 3 o'clock tomorrow afternoon.
I will move we authorize staff to assist as needed to help the Virginia Foundation move to their new digs.
Thank you, Councilor Johnson. Moved by Councilor Johnson to approve. Is there support?
I'll support.
Support by Councilor Paulson. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries. Thank you. We'll move to item 9, committee reports. Item 9.1, the committee of the whole meeting that was held on October 1st, 2019. And I'll turn this portion of the city council meeting over to our city administrator, Britt C. Bendis. Britt?
Mayor, if I may,
Yes.
at our previous committee of the whole meeting on September 17th, we asked representatives from Northeast Service Co-op to attend to talk about our insurance rate increase.
Yes, we did.
We do have Jeanette Melismone here from Northeast
Oh, we
Service
do?
Co-op
Oh,
to discuss
hey.
the rate increase. So maybe it might be an appropriate time to bring her up now.
Please, and her name again?
Thank you. Jeanette Melismone.
Ms. Melismone, please come forward. I'm sorry, I didn't realize that. Please state your name for the record, and welcome to the council meeting. Thank you.
Thank you for having me. Jeanette Melismone.
Okay, thank you, Ms. Melismone. And we're looking for some information about the Northeast Co-op and the particularly the percentage increase of healthcare that was is being proposed or being adopted for our AFSCME employees. Is that correct? So if you give us a little explanation on how that was facilitated and what prompted the increase, and could you please explain how much that was and why that increase was more or less what it is?
Sure.
Thank you.
So in preparation for today's meeting, I did take a look at rate increases for the city over the course of the past 9 years. It should be noted that the city purchases health insurance along with the public utility, so you're considered one group and it's rated as one group. In the past 9 years, you have had single-digit increases, and what I would describe as low single-digit increases 6 of those 9 years. So when I look at something as being a low single-digit increase, I'm looking at things that are lower than trend, and trend is between 7 and 8%. So of those 9 years, 6 of them, you performed better than trend. A couple of them, you did not. So I think our recent memory tends to have us think about the bad years, and then we forget about the good years. So I wanted to open with that, because I know you had a challenge a few years back. When we do our rating, we look at the groups as a whole throughout our block of business, and we rate all of those groups in the same manner. We look at 24 months of claims data, And for a group of your size, we throw out claims above $200,000. And so what that means is if an individual has a high claim above $200,000, we throw out anything above the $200,000 in terms of rating you. So those claims don't hurt you. You can have an individual who has $1 million claim, and we're only including $200,000 of that in your rating projection. Then I mentioned we looked at 24 months. Those are broken into two 12-month periods. The first 12 months is the most recent 12 months, and the second 12 months is, of course, the older 12-month period. You might ask, why do you use 24 months? It's kind of an industry standard sort of thing. We weight the most recent 12 months at a higher level than what we rate the second 12 months. And that is simply because it's the best predictor of what future claims will be, is your most recent claims. Industry standard across other carriers, they do the same thing, so they often weight the most current. Some carriers only look at 12 months of data. We look at 24. The second thing that we do after that is we consistently rate groups year over year. So every year we begin the rating renewal process in July, and we complete it in August. The plan year doesn't begin until January. So we're looking at things at a very early time in that regard. And one might say, gosh, why do you start in the summer for something that doesn't even start until January? And the reason is really rather simple. It's because our members have asked us to. There's a budgeting process that takes place in our cities and counties that is due at the end of August or mid-September so that you can meet levy deadlines. And so that's why we begin that renewal process so early. It's early, but it's what membership wants. After we look at the 12 months and we weight it, then we do apply pooling. And so what we do is we have some reserves that we set aside to buy down the needs of the pool. We have an advisory committee, of which from the PUC we have Nancy invited, and from the city we have Sherry invited, and they're welcome to attend that advisory committee process. The advisory committee helps shape what the pooling renewal formula looks like. After that, then we develop our renewal materials and we hand deliver them to each group for approval. So I think one of the things that we tend to forget is we think claims are the same year over year, and they're not. They do change. You know, I have the benefit of seeing the 44 groups in the city-county pool that participate in our regional pool, but I also have the benefit of seeing statewide the other 7 service co-ops who provide health insurance. And so I can see trends amongst those groups. And what I can tell you is there is a kind of a natural ebb and flow. You have a period of time where you have lower increases, often followed by a period of time where you have higher increases. So it is kind of the normal flow of how claims work in a group. There's no one group that gets the same increase year over year. There just seems to be this peak and valley that occurs. Does that answer your question?
Thank you. Let's move to the city councilors. I think they may have some questions for you. Councilor Johnson?
So this year, the increase is 2.2, is that the number I remember? Okay, so I guess I would appreciate some specific numbers rather than your generalities of some years it's high and some. I've been on the council for 3 years, and every year of the last 3 years, it's been double digits, is my recollection. So if you could go, do you have the last 9 years, year by year? And what has been the total increase from 9 years ago to, because as I'm looking, and the part of this is that we were anticipating, I mean, we budget for a 10% increase. That's just become a natural thing for the city to do. And then to get a 2.2, it was a real shock, and why hasn't that happened before? So I guess the question I'd like to answer is, do you have the specific numbers from the last 9 years? And over the last 9 years, what is the total increase of the insurance rates?
So I'll begin in 2012. You received a 1.5% increase. 2013, you received a 4.8. 2014, 5.7. 2015, 3.7. 2016, 11.7. I should note at this point in time, you migrated about 44 individuals off of the TRAD plan that you had onto the VIVA plan. So I can speak as to how that would impact you, but I think the focus of today is really on the 2.1. So I'll continue and we can circle back if you'd like. In 2017, this is the one you remember, 19.6. In 2018, you had a 6.2. In 2019, 12.4. In 2020, 2.1. 9-year average of 7.5%.
Thank you, that's helpful. I'm sorry, it was 7.5.
7.5,
1.5,
the 9-year average.
9-year average, okay. Counselor Johnson, are you, anything else to add before we move?
I will later, I'm doing some math.
Okay, thank you very much. Counselor Paulson.
I wasn't expecting to have you here, so I didn't have my insurance documentation together with me tonight. But, so if we were given in 2019 that 12.2%, that would have affected 2020, is that correct?
So the income increase in 19 would, of course, be your starting point for income in 2020.
So that, did I write it wrong? In 19, it was projected, I actually thought it was 12.8. You're saying
2019, your increase was 12.4.
12.4. And I believe that's what started us on our path to exploration because of that rate. So then, but we were not, in my opinion, the insurance committee wasn't brought that rate wasn't brought forward until after July. Then we met as a committee and started having those discussions in October. So those rates are determined in July.
So in July of 18 is when the 1/1 of 19 rates would take effect.
So we would have gotten the information on the 12.4% increase in 18 July. Okay. And I think, I guess I'd have to go back and look at all of our paperwork to see if that's when we started to kind of just look at, those costs associated. So then this July, we should have received information that the rates went down to 2.2%. And so did we receive that in July? It was beginning in September.
So I want to clarify, we begin our renewal process in July. We release rates in August.
Okay.
Set up a meeting
Okay,
with
so
the
that
city.
makes,
Sorry, was that me?
don't know where that's coming from.
Oh, that's not you.
That makes more sense then, because then I think it came up to us in our October meeting then of last year at that higher rate of increase. So in your opinion, would it have been the group members that moved on into the PEEP program that have changed or lowered the rate to that 2.2%?
So actually, I think the population that left and the population that stayed were fairly equal in terms of claims.
In terms of claims?
Correct. Yep. So I know we want to assume that every year we're going to get the same sort of increase year over year. But the fact of the matter is, some years you have lower claims. So if you have 5 people that have hip replacements this year, you likely aren't going to have 5 next year. So you can kind of have these bumps up and then down.
Okay, thank you so much for that. I appreciate it.
Thank you, Counselor Paulson. Anyone else? Counselor Johnson.
I added up the percentages, it's 65.6% over 9 years. Was that standard in the industry?
So you would then divide by how many
Well,
years
no,
that is for an average increase
Which
per
is
year.
8.2, but 65% insurance increase over 9 years is a lot of increase for anybody. And I know a former employer of mine also saw that and had to make changes. So I'm just curious to know, is that industry, is 8.2 average for an industry or the industry over the last
The
9
trend
years?
is 7 to 8% annually. So if we figure 8% annually for 9 years, that would be 72%. If you figured 7% for 9 years, that'd be 63%. So you're right in the ballpark of what medical trend is.
I appreciate you coming to explain it. It's quite shocking to see 2.2% after 12. I mean, that's very,
But it's a good thing for your budget.
yeah.
That's true. It's a good thing for our budget. And on our please refresh my memory here, if you would, please, Britt or Sherry. Sherry, I guess you're not available today. Britt, so under the Northeast Cooperative, we have one group in the city of Virginia that's under that, right? I mean, not including the public utilities, but our ASME union.
One
is that-
bargaining unit, yes.
One bargaining unit. We have one bargaining unit that's on there. Everybody else has converted, right? Okay, thank you. So the 2.2 increase is being affected only, there's the one bargaining unit, which is probably a relief for our bargaining unit to only get a 2.2% increase. I mean, I know that Councilor Johnson asked about the industry standard, and Ms. Mellismon, I'm glad, and thank you for coming in and talking to us about this. I know I talked to my friends who work down in the metro who see these increases themselves based upon, a variety of reasons, and their healthcare premium goes up, but the cost of their healthcare premiums per employee is significantly higher than the cost of premiums for our employees here. So, I think the question is, how does that work? And it was really educational for me to see that 9-year average moving forward. And there was a couple of years in there where, it was a shock and awe with the double-digit increases. And there's a perception through our budgeting process that, well, we have to budget for 11% because we don't know what it's going to be. So during this process, when we decide we're going to budget for 11%, when in September these numbers are released, we should know that it's not going to be 11%. We should know that it was 2.2%. So by budgeting for 11% in the 2020 budget, based upon those figures that we get in September, I guess I was kind of looking for a little bit more. We'll get some more internal documentation information about how we disseminate that information to our staffs, to us. So does anybody have anything they'd like to add? Any other questions or comments for the Northeast Co-op?
I do,
Yes,
Mayor.
Councilor Bearable.
I think one of our big headaches was the fact that when we look back over the last 4 years, it was a 12.3 average increase. It was not the small increases. And when we were talking about 18, that was for this year, that was 12.4, and they didn't back off Northeast Cooperative Services at all on that number. So this number they're talking about is for 2020, but we're locked in right now for another year, and we don't know what our rate's going to be for 2020 yet, because they could increase our rate with the current carrier that
We're
we're
not going to know that till September.
Yeah.
We held the rate from 1919 to 2020.
Did they hold the rate?
Held the rate,
I
yeah,
thought they had
thank
a
you.
change.
Thank
It's
you for that,
after the
Pam.
18 months
Yes.
then, okay.
They held their rate.
All right.
Thank you, Pam.
So we could go back and look at Northeast Cooperative again then if we want to. I'm surprised if these groups are equal of course, the ASME unit paid that 12.4 in 19, didn't they? Yeah, so, okay, never mind then. Answer my own question.
Thank you, Councilor Bearable. Councilor Paulson.
Thank you, Mayor. In light of all this conversation and this discussion, I just feel it would be prudent for the insurance committee to set a meeting going forward to kind of reevaluate where we're at and with PEEP and where PEEP is at. I mean, this is the typical time for that. It would be in an October meeting. I would assume that's when we've kind of had to hurry up and figure it out by October 31st. So with that being said, I don't know who needs to set that meeting. I don't think I can. I don't think I'm the chairperson.
We can make a motion. That the
Can I make
insurance
a
committee
motion
meets.
to have
Certainly,
the chairperson?
Absolutely.
I will support, as
the
chair,
call-
I'll support.
Okay, so
Okay, I will make a motion to set
insurance committee meeting.
insurance committee meeting.
A motion by Councilor Paulson and a support by the chairman of that committee, Councilor Johnson. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries. Thank you. Anybody else? Thank you very much for coming in
Thank you.
tonight and doing this for us.
Happy
Very, very educational for me. Thank you very much.
Certainly contact our office anytime. We're happy to answer questions.
Thank you, thank you. And I apologize, I didn't realize that here in the back, okay, we'll move to item 9, committee reports, the committee meeting of the whole that was held on October 1st, 2019. And now we'll turn this portion of the council meeting over to our city administrator, Britt C. Bennis. Britt?
Thank you. On Tuesday, October 1st, we had a committee of the whole meeting. It was moved and supported to approve the resolution for the contract with Jarrick and Associates as a lobbyist for the city of Virginia, with our designated topic being the public safety building for 1 year at $3,000 per month, and requests that the resolution does contain the verbiage regarding communication of a quarterly report as requested by the council. The resolution's in your packet. I'm sorry.
Moved to approve the contract by Councilor Paulson. Is there support? Support by Councilor Beyondich. Is there any further discussion? Councilor Johnson.
I just want to thank Jarrick and Associates representative for coming up to the committee of the whole meeting and really clarifying a lot of the concerns that I had about communication and what was happening. It was nice to see that, and I appreciate that it's written in that they'll be sending at least minimum some reports so that we all have the same information. I want to make sure that this isn't one of those things we're just brushing over, that we did get what we asked for, and appreciate that very much.
Yeah, thank you, Councilor Johnson. It's been moved and supported. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carries. Thank you.
Mr. Matt Reed, our engineer of record from SEH, presented the request from Casper Construction for an extension for the Midway Drive Improvement Project. It was moved and supported to deny the request from Casper Construction for the extension of the deadline of that project. And I would like to note the work is still proceeding, even though we denied the extension.
Councilor Johnson?
I will move denial of that request.
Moved by Councilor Johnson. Is there support?
I'll support.
Support by Councilor Baraboo. Is there any further discussion? Councilor Johnson?
Thank you, Mayor. And the reason we deny it is because if we approve a later date, then any recourse we might have as city disappears. So we're keeping our options open and not limiting ourselves by denying the request. The work is still being done. If it ever stops raining, it'll probably get done.
Thank you. Any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Motion carries.
Additionally, Mr. Reed presented to the council a resolution for a change order number 2 for the Midway Drive Improvement Project, which actually decreased the contract by $8,255.83. And the decrease was because the material that had to be brought to the landfill had to be paid by the city because Casper Construction did not have an account with the county. Only the city does, so we had to pay the bill ourselves directly.
Very good. So we didn't save money.
We didn't
just-
save much, we paid it outside of our own pocket,
Okay.
but
All right, very good. Thank you. Do I have a motion? Moved by Councilor Johnson to approve, supported by Councilor Barnzelli. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
the council approved the resolution for the 3-year service agreement with Procare Services and Stryker for the power load cot maintenance in the total amount of the 3-year term of $36,571.51, and staff was asked to ensure that this was a budgeted item.
Councilor Barnzelli moves to approve. Is there support?
I'll support.
Support by Councilor Paulson. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
Fire Marshal Chris Clark was at the meeting to discuss the vacant building registration ordinance and building application. That there's been a committee of us working on it, myself, the police department chief and deputy chief, the fire marshal, the fire department chief and deputy chief have been working on a couple ordinances throughout town. With that new ordinance, any vacant structure would have to be registered with the city within 30 days of vacancy and pay an annual fee for the vacancy. The fee will increase every year that the building remains vacant. This is not intended for snowbirds. This is intended for buildings that are left vacant, usually going tax forfeit, ones that we have issues with. This is not an intention to hurt anybody that goes away for 6 months or a long period of time. It was moved and supported to approve the first reading of the vacant building registration ordinance with the recommended changes to the vacant building application. And you'll note the new applications in your packet. It now allows for a checklist. Are they on or not applicable?
Very good. Counselor Johnson?
I will move the first reading of the ordinance, and good job on that, the utility status change. It looks very nice.
Moved to approve by Counselor Johnson. Is there support? Is there support? Support? Who did? I didn't hear that, so I apologize. Supported by Counselor Barnzelli. Is there any further discussion? Hearing none, all those in favor signify by, oh, I'm sorry, Counselor Paulson.
Thank you, Mayor. On this changing of the ordinance, if we wanted to ever add anything in terms of like a business, like a section X point, whatever, could that be done in terms of like exit strategy with their signage?
Yes.
That could be added on this checklist, or
Absolutely, absolutely.
would the ordinance need to change in order to do that then, or would it just be like an amendment to the ordinance?
It would be amendment to the ordinance, which is required 2 readings, so about a
Okay.
2-meeting process to make a
Okay.
change.
Thank you.
Yep.
Okay, thank you, Counselor Paulson. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye, opposed? Motion carries.
Fire Marshal Clark also presented the business fire occupancy ordinance, and this would require all businesses within the city to register with the city. This would help assist the fire department with ensuring that some of the ordinances that we already have in place are being followed, such as the Knox box ordinance, and allows us to be aware of all the businesses that do pop up in town, who's running them, and where they're located. It was moved and supported to approve the proposed business fire occupancy ordinance and the business fire application for the first reading.
And there's no fee for this.
There is a fee for this.
Okay.
It is based on square feet.
Okay.
The minimum is $25.
Okay, very good. And thank you. What is the council's looking for a motion one way or the other? I guess I'll, while you're contemplating and reading this, I think these ordinances are necessary. They really are. And I know that Fire Marshal Clark explained at the committee of the whole meeting about the ordinance amendment and the fire application. But, I still have a little, not angst, but just a little concern about, just a business fee here, a vacant building business fee there, fee over here, fee over there. I can see that. I know part of the rental code ordinance, which will likely be forthcoming, as we discussed at the link a couple of years back. I think, if a person fails to register and you notify that person and they don't register, then maybe I can see a fine, but to require a business who's in town to register now and pay a fee to register their business, I don't get it.
I would like to point out the fee structures are not included in the ordinance. That will be set by resolution of the council at a later date.
Okay, very good. Thank you.
Yes.
That helps.
So we do have the ability, if we do feel it's going to be a burdensome hardship on businesses, we could make that a very low-cost fee.
So the fee schedule is not in this
It's
ordinance?
not set yet, no.
Very good. Okay, thank you then.
Yes.
That makes it a little more comfortable for me. Okay, anybody on the council would like to move this forward or not? I'm looking for a motion. Is there a motion? Councilor Beyondich makes that motion. To approve, is there support? Support by Councilor Johnson. Is there any further discussion? Council Bearable?
Yeah, I want to see the fee schedule before we approve this thing, or is that going to be a separate approval?
It's a separate approval by resolution.
So where is this actually on our agenda? Because was this just this, 'cause I don't see F there at all. In our working up, I see the other big, long portion, but I don't see F anyplace. When I looked at before the meeting, I see E, that's the big, long one. And then it comes up and there's no annotation, but there's another resolution. Is that what we're talking about? It's a little short thing? It has just sections?
Committee of the whole, we did have it in that packet, the last meeting, the business
Well,
registration.
it should be in the council meeting so we can reread it.
Okay.
So I can't vote for this until I reread this thing, because it wasn't there when I read my council packet. Because we have the different sections here, if that's the one we're looking at, you have section 1801, 02, 03, 04, but there's nothing, it says penalties appeal, it tells you things, we don't actually have it.
No, then there's no real hurry, Counselor Bear, but we can definitely refer it to the next committee of the whole meeting.
Well, that's all I'm asking is that we can, because,
Absolutely, yeah. The intent of this ordinance was to be effective in January. If it becomes effective in March, April, it really would not hurt our feelings whatsoever.
yeah, because I didn't go back and look at that one from the committee of the whole. I have to
Absolutely.
be honest with you.
Yeah, it doesn't look like it made it into the packet. I apologize.
Okay. Can we just table this until,
Well, we have a motion on the floor in support,
well, we can do a tabling
and
motion, can't we?
so
Or you can refer to the,
You have to.
we could just refer it.
Okay, that's fine too.
So you're asking to refer this back to the committee of the whole, meaning
Yeah.
for additional discussion?
The people that made the motion would have to make a change to do
Well,
that.
that's the point I was trying to make here. So, the maker of the motion, oh, I'm sorry, go ahead, Counselor Johnson.
Is anything in this, the approval of this portion different from what was what was presented at the committee of the whole meeting? So it's the exact same thing?
And my only question is I didn't see a fee schedule in there that there was going to actually be adopted, so that was my question. I mean, I read the ordinance, I read what's moving forward, I think it was well-written, makes perfect sense, and when we discussed that at the committee of the whole meeting, my one question was about that. So if other councilors aren't comfortable, would like to do something, have some more information, we could certainly refer it back to the committee of the whole meeting, so everybody has an opportunity to review and refresh their memory. Counselor Paulson?
Thank you, Mayor. This was the business fire occupancy ordinance that we're
Yeah, that's
talking
correct.
about. So this is just regarding the occupancies.
I know, and my problem is we have the resolution there, but I didn't go back to reread this because we went through it quick at the
We did,
committee of the whole.
we did.
So that's all I'm saying. I would like to have read it before tonight's meeting, but it didn't actually show there. It just showed the quick steps there with the coverage with the sections, and that's all I saw.
Counselor Paulson?
So I would feel maybe a little bit better reviewing it together again, if that's okay. Although I was comfortable with it when Chris Clark presented it, but it may be prudent to go over once more.
Well, we could move it back to back to October 15th.
As long as we have until January, so we
So,
might.
Yeah, that's all that's all
I'm
I'm
comfortable
asking.
with that.
I just want to reread it, and I can go home and do that.
Who made the motion? Rescind? Second? Okay. So now, we'll just, do you need a motion to refer that back? Okay, let's have a motion to refer it back to the committee of the whole meeting, which will be scheduled for Tuesday, the 15th of October. You're making that motion, Counselor Bearable. Is there support?
I will make that.
Is there support? Support by Counselor Johnson. Thank you, Counselor Johnson. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries. This matter is referred back to the committee of the whole meeting Tuesday, October the 15th. Thank you.
It was moved and supported to approve the submission and receipt of grant funds from the state of Minnesota for the Towards Zero Deaths Enforcement Project in the amount of $51,825.
And we are kind of the fiscal agent for that.
We are the fiscal agent for that.
Thank you.
I'll move to approve.
Moved by Counselor Paulson to approve. Is there support? Support by Counselor Johnson. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
It was moved and supported to approve the resolution for the quote from Takala Farms for biosolid removal in the total amount of $24,600.
Also move, Mayor.
Yeah, move to approve by Counselor Bearable. Is there support?
Or
Support by Counselor Johnson. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries. Thank you.
We had received a request for a handicap parking spot at 115 3rd Street South. The council noted that these are not private parking spaces if a handicap spot is designated, and during the winter, it is only applicable every other day due to calendar parking. Because of these reasons, it was moved and supported to deny the request for handicap parking spot located at 115 3rd Street South, and a letter will be sent regarding the denial.
Moved by Counselor Johnson. Is there support?
I'll support, Mayor.
Support by Counselor Bearable. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
It was moved and supported to approve the parade route for ISD 706 Homecoming Parade on October 11th, 2019, and the city will provide barricades to block the street.
Moved by Counselor Johnson. Is there support? Support by Counselor Barnzelli. Is there any further discussion? Go Blue Devils, right? Homecoming, football game. All right. And I just shouldn't say this publicly, but it could be, I'm not saying it is, could be the last game that's being played at Blue Devil Stadium at the minor, so everybody get out there and support the Virginia Blue Devil football team. Thank you. Moved and supported. Any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
We have been notified that Mr. Tom Budarak will be ceasing his contract on December 31st, 2019, and will not be renewing it. A draft request for proposals was presented for legal services. It was moved and supported to move forward with the RFP or request for proposals for legal services for 2020.
Moved by Counselor Johnson to approve the RFPs. Is there support? Is there support? Support by Counselor Beyondich. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
Discussion was held regarding the request for a part-time library clerk at the Virginia Public Library. It was moved and supported to approve continuing with the hiring process for a permanent part-time library clerk position.
Do I have a motion?
I'll move the hiring of a part-time library clerk at the library.
Moved by Counselor Johnson. Is there support?
I'll support that, Mayor.
Support by Counselor Barnzelli and Counselor Beyondich. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion. Roll call, please.
Huffy,
Aye.
Baraboo. Friedlieb is absent. Paulson,
Yes.
Beyondich,
Yes.
Johnson,
Yes.
Sally.
Yes.
A motion passes 5-1. Thank you.
Thank you. It was moved and supported to approve the noted changes to the city hiring policy, and it is in your packet, the updates that were requested.
And as you move forward, I think that you made the requested changes by the council.
Correct.
And hopefully it'll be a policy that's a little more streamlined moving forward and a little more clear. So what is the councilor's desire to move this or not? Counselor Paulson.
Move to approve.
Counselor Paulson moves to approve the new hiring policy changes. Is there support?
I'll support.
Support by Counselor Baraboo. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
It was moved and supported to receive and file notice of proposed sale of St. Louis County tax forfeited property within the city of Virginia. There's 3 parcels. The land sale is this Thursday, in case anybody's interested. There's no action needed by the council. Thank you. It was moved and supported to set a public hearing on October 22nd, 2019 at 5 p.m. for the amendment of the ordinance for the stormwater service charge system, and this is in preparation for our 2021 street project.
Yes. So we're looking for a motion from the council to set a public hearing on October 22nd, 2019 at 5 p.m. for the amendment of the ordinance for the stormwater service charge system will be part of what fuels our 2021 street improvement projects.
So moved.
Moved by Counselor Johnson. Is there support? Is there support? Yes, supported by Counselor Baraboo. Is there any further discussion? We'll be setting a public hearing date for that date, and then street and alley get busy. Okay, thank you. All those in favor signify by saying aye. Aye. Opposed? Motion carries.
We had a request from a private party who was looking to purchase the Mako Theater for an entertainment venue. Their request was to ensure that the city had enough liquor licenses available. It was moved and supported to approve the possible purchase of the Mako Theater for an entertainment venue in the city of Virginia and to allow the business to acquire a liquor license in the future if the building is indeed purchased. And I have noticed that there is a sold sign on it. So
Very good. So we did tentatively approve at committee of the whole, so it was moved and supported there, provided that he meets all the requirements, obviously. Counselor Johnson.
I will move to move forward with letting them know that there are available liquor licenses, and we are.
Okay, thank you. It's moved by Counselor Johnson. Is there support? Support by Counselor Beyondich. Is there any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? Motion carries.
I have no further items from this meeting. Thank you.
Thank you, Britt. We'll move to item 10, Commission Liaison and Department Head Reports. Is there anybody from the City Council who'd like to give a report today? Seeing none, we'll move to our department heads. Anything else you'd like to add, Britt?
I would. Brian Silbert, Park and Recreation Director, and I will be attending the school board meeting next week to give them an update about our MEC, our minors project, where we are and what's going on.
Very good, thank you. Look forward to listening in as you make that presentation. Mr. Budarak, our city attorney? Nothing else. Thank you very much. How about you, Pam? Anything for you? No, nothing. And anything from Sherry as an absentee? No, nothing? Okay, thank you. All right, I just have one thing I'd like to bring forward, and it's Freedom Day, Freedom Week. And every year, we don't have a proclamation, but hopefully next week or the week after, we'll do that. But I just want to recognize two businesses in the city, and there may be many others, but I'm only aware of two. So if anybody else knows of any, or anybody in the audience can articulate, we certainly would like to recognize those businesses for caring for the vets, free medical service or free service to give to the vets on one Freedom Day. And one of them is Dr. Miskovich, the dentist, and his staff. And the other is Dr. Berg from his dental practice off on 4th Street. So those I think you've seen their names in the paper, but they continue to support veterans' causes and really kind of recognize Freedom Day. And I'm sure there are other businesses do the same. So if you know of a business or you are a business, please let us know. We'd like to recognize you for, really taking the time out and addressing the issue about vets and their needs for health care and other services that we provide within the city of Virginia. So thank you for that. So, okay. Do we have anything else to come before the council this evening? We're still standing. Demolition is beginning. No earth shaking yet, so we're good shape. So we will adjourn to the next city council meeting, which will be Tuesday, October 22nd, 2019, at 5:30 p.m. in the council chambers. Everybody have a great week, and thank you. We stand adjourned.